So in this topic, we'll be seeing overall all the drugs which are used for constipation. Now we know we have spoken about the constipation, the reason, the causes, the actual problem, and how the stool forms. There are mainly four different types of drugs which can be used for constipation. First one is bulk forming. So we know that this gut is there. So the first thing which we can do is to make sure that actually we form a good quality large volume stool which is soft. So if there is no bulk of this stool which is formed, then it is very difficult for the gut to push or propel the food forward. Just imagine that some patient has very little stool like this. So if the patient has only this much of stool, how can the gut propel the food which is very lesser in quantity? And at the same time, if someone has, suppose, a large volume stool which is very soft, then it is very difficult. Just push and it will be pushed forward. Just push and it will be pushed forward because the gut is all in tubular form, and it is very easy for the gut to propel the food which is soft, fluffy, and has a large volume. So the first drug is bulk forming, which mainly comprises of dietary fibers, because I told already also most of the things of the food, they get absorbed in the blood vessel, they get transported to the blood, but the fibers stay in the gut. They don't cross from the gut to the blood. That is the reason why they form a good quality soft stool bulk. So that bulkiness has to be there. So first one is bulk forming, where we use bran, psyllium, isabgol, and methylcellulose. The second type of drug is stool softener. Here, what we are achieving is, many of the patients, they do have stool, but what they complain is their stool is very hard. The stool is very hard. We know, we have seen the definition of the constipation. Many of the patient has to put their fingers in, and they need to remove this hard, lumpy stool. So these drugs basically go around this stool which is already formed, and they will actually be more of a doing like oiling of the food. They will increase the greasiness of the stool, so that this stool which is very hard simply slips away from the gut. You can simply if you can remember, if you have a ring in your ring finger, it is very difficult to remove the tight ring from your fingers if you are not using anything. At the same place, if you apply some oil or grease, or if you put some Dettol in it, that liquidness can very easily remove the ring from your ring finger, just because of the greasiness or oiliness. Here also we are doing the same thing. The stool is very hard, lumpy, and it is more of impacted. So what we do is we simply take stool softener, which will be doing like greasing of the stool, which will increase the oiliness around the stool, so that it easily slips away from the uh, sigmoid region or anus region, and it can relieve the constipation. The third type of drugs is stimulant purgatives. This is used in those patients where the stool volume is very less, and we need to increase the stool volume so that the stool can be passed very easily, especially from the lower gut, where we very commonly used sodium picosulfate, bisacodyl, which is very famously present in Dalcoflex tablet, or Senna, Cascara, or the tablet Procoloprid, or we can use castor oil also. And the four type of drugs are osmotic purgatives, where we actually use an osmotically active agent which actually increases the content of the water in the gut, and it increases the quality, increases the softness of the stool, increases the bulk of the stool, and the stool can be passed very easily. So we'll be coming to each and every drug very in detail soon.